Imagine walking into like a high-end, beautifully decorated medical clinic.
Right.
You've worked a cosmetic procedure, you've signed all the comprehensive consent forms, and you've paid thousands of dollars out of pocket. You are, by all accounts, a completely willing participant.
Yeah. Completely voluntary.
Exactly. But months later, the physical and emotional aftermath of that procedure is so devastating that you actually find yourself checking into a medical center that is specifically dedicated to treating survivors of genital mutilation.
It sounds like a psychological thriller, honestly.
Yeah.
But it is a documented medical reality.
Yeah.
We are looking at cases where the line between, cosmetic enhancement and profound psychological trauma just completely dissolves.
I'm so glad you are joining us today because we are opening up a massive stack of medical literature for this deep dive.
We really are.
We've got clinical guidelines, surgical center marketing materials, ethical position papers, and some just truly staggering psychiatric case studies. And they all center around one rapidly growing field, which is cosmetic gynecology, or as it's often marketed to you, vaginal rejuvenation.
Right. And we are going to look way past the glossy before and after photos today.
Because we hear a lot about the physical aspects of vaginal tightening and labiaplasty. The marketing is absolutely everywhere. It's targeting insecurities you probably didn't even know you're supposed to have, right?
Oh, absolutely.
But the core question we want to answer today is this. Can these procedures actually become psychologically harmful?
And when you lay the clinical data side by side with the psychiatric outcomes, well, the reality is a lot darker than a simple nip and tuck.
So to understand the psychological harm, I feel like we first have to figure out the psychological motivations driving the massive spike in these procedures, because the numbers are astronomical.
They really are.
The American Society for Aesthetic Plastic Surgery tracked a 217.3% increase in labiaplasty over just a 5-year period in the United States.
Yeah, and a surge like that isn't just a gradual shift in medical needs,
Right.
It is a cultural tidal wave. And it's being driven by a few highly specific kind of converging factors. Like over the last couple of decades, grooming habits have changed drastically.
Totally.
The rise of the Brazilian wax and laser hair removal means that for a lot of people, the anatomy is suddenly much more visible to the individual than it was for previous generations.
The curtain has essentially been pulled back, and
Yeah.
suddenly you're looking at something you previously just ignored, and you start scrutinizing it.
Exactly. And what are they comparing themselves to? That's the issue. The psychological literature highlights the profound impact of digital communication and pornography here.
Yeah.
We are seeing a generation exposed to images that have been heavily curated, digitally modified, and algorithmically pushed. And it promotes a very narrow, highly specific aesthetic.
Okay, let's unpack this because it feels like we're applying Instagram face filters to human genitalia.
Yes.
We're taking a completely normal biological variation and treating it like a correctable flaw.
The clinical term that gets thrown around for this is the prepubertal look, or the Barbie vulva.
Wow.
Yeah. It's an aesthetic where the inner labia, the labia minora, they just do not protrude beyond the outer labia. It creates this societal myth of the perfect anatomy.
But biological reality simply does not match that image. Like, the medical guidelines are emphatic about this. The labia minora come in all shapes, sizes, and colors.
Right. There is no one normal.
Some are highly asymmetrical, some change shape after childbirth or just with age. That is just standard human anatomy. It's not a medical condition.
Try telling that to a marketing department, though.
Fair point.
We are looking at clinic websites using terms like revirgination and vaginal rejuvenation, or even designer laser vaginoplasty. And this language performs a very dangerous psychological trick. It medicalizes normal anatomical diversity. It takes a natural variation and literally labels it a syndrome that requires a cure.
I mean, designer laser vaginoplasty sounds like you're outfitting a luxury condo, not operating on a highly sensitive human organ.
Yeah, and what's fascinating here is that the psychological harm begins long before a scalpel is even sterilized.
How so?
Well, this marketing creates what psychologists refer to as genital anxiety. You have perfectly healthy individuals who are led to believe their bodies are abnormal or ugly or dysfunctional. And that just fuels these deep-seated, manufactured insecurities.
And the advertising suggests these procedures are a simple, quick fix for self-esteem and sexual satisfaction.
Exactly.
It promises emotional well-being through surgical intervention. So if someone is seeking these procedures to fix this manufactured anxiety, what actually happens when the physical reality of the surgery doesn't match the glossy brochure?
We have to look at the sheer variety of procedures being offered to understand the fallout there.
Yeah.
You have surgical options like vaginoplasty, which aims to tighten the vaginal canal, or labiaplasty, which literally cuts away tissue.
Right.
But then you have the non-surgical options that are aggressively marketed as like a lunchtime procedure.
Oh, the energy-based devices.
The ones using lasers or radio frequency to supposedly stimulate collagen and tighten tissue.
Okay, let me stop you there and play devil's advocate for a second.
Go for it.
Wait, if non-surgical options like radiofrequency just use heat and there are no scalpels, no cutting, shouldn't that be the psychologically safer route?
You would think so.
Right. But I was reading through the FDA's recent communications, and they issued incredibly strong warnings about these exact energy-based devices. Why are they so worried?
It really comes down to cellular mechanics. Non-surgical absolutely does not mean non-invasive to the tissue.
Ah.
If you use a laser or radiofrequency device, you're using thermal energy heat to provoke a healing response. On facial skin, sure, that might tighten a wrinkle. But here, we're talking about highly innervated, delicate mucosal tissue.
That sounds incredibly painful if it goes wrong.
It is. The FDA warned that using these devices for vaginal rejuvenation can cause severe burns, permanent scarring, and chronic pain.
Because you are basically creating internal scar tissue to create a feeling of tightness. And scar tissue doesn't stretch.
It doesn't stretch at all.
It doesn't lubricate either. So chronic pain in that area inevitably leads to dyspareunia, which is painful sexual intercourse.
And that physical complication triggers a devastating psychological loop. Think about it. The patient sought the procedure to improve their sexual confidence.
Right, to feel better.
But the resulting thermal damage or scarring makes intimacy excruciatingly painful, or even physically impossible.
Wow.
The supposed cure for their insecurity actually destroys their sexual function, and that leads to deep depression, profound anxiety, and just a total collapse of self-esteem.
That is heartbreaking, and the surgical side is just as alarming. Let's look at the data from Dr. Grass, a German plastic surgeon.
Yes, his data is eye-opening.
Over a 6-year period, he performed 702 reconstructions. And these weren't primary surgeries. These were complex procedures to fix botched labiaplasties performed by other doctors.
702 revisions is a staggering number for one clinic.
It really is.
And reconstructing that tissue is incredibly complex.
Yeah.
Because the vascular supply, the blood flow, has often been completely compromised by the first surgery.
The psychiatric statistics from his patients are just so sad. After their primary botched surgery, 98% of these patients felt psychologically impaired by their appearance.
98%.
Yes. 76% experienced chronic pain, and 14% were in so much distress they had to seek clinical psychiatric help.
And one of the specific physical complications that drives this distress is something called the small penis deformity.
Just the clinical name alone is jarring. What actually causes that?
It occurs when a surgeon aggressively removes too much of the labia minora, but they leave behind excessive bulky tissue around the clitoral hood.
Oh, I see.
So the resulting anatomical proportion visually mimics a small penis.
Yeah.
For a patient who went in specifically seeking a hyper-feminized, delicate Barbie aesthetic, waking up to that visual mismatch is psychologically shattering.
It is the exact opposite of what they were sold.
Exactly.
You are permanently altering highly vascular tissue with complex nerve networks. If you sever those nerve endings, you are permanently altering sexual function.
And a permanent loss of sensation or the onset of chronic pain, it leaves the patient with a profound sense of regret and betrayal. The doctor promised them rejuvenation and delivered irreversible nerve damage.
So we've established how physical complications cause psychological distress. But the medical literature reveals an even darker phenomenon.
Yeah, it gets much heavier.
Sometimes the incision heals perfectly. There is no infection, no nerve damage. But the surgery itself is processed by the brain as trauma.
This is where we cross the line from cosmetic dissatisfaction into profound psychiatric injury. The case studies from the Geneva University hospitals illustrate this perfectly.
This part of the research completely stopped me in my tracks.
I'm not surprised.
Researchers documented 3 women who voluntarily consented to female genital cosmetic surgery, or FGCS. They signed the forms, they paid the money, they walked in willingly.
Totally elective.
But later, they sought help at a clinic dedicated to treating survivors of female genital mutilation, or FGM.
Right, and just for context, an FGM clinic typically treats migrants or refugees who have been subjected to forced culturally motivated genital cutting.
Right.
But here were three Swiss women who had undergone elective, expensive cosmetic surgery, knocking on their door asking for help.
How can someone sign a consent form, willingly go into a clinic, and then genuinely feel like they've been mutilated? How does the brain make that leap?
Well, the World Health Organization defines mutilation largely by the intent and the lack of medical necessity. But these patients demonstrate that mutilation isn't just about the surgeon's intent.
It's about the outcome.
It is about the patient's psychological consequence. They felt they had been irreversibly damaged, harmed, and stripped of an essential part of their body in a way they couldn't possibly comprehend when they initially signed that consent form.
Let's look at the specific cases to really understand why. Because there is a 31-year-old woman who had a cycling accident as a teenager that physically tore her anatomy, leading to chronic pain.
Right.
She was diagnosed with PTSD from the accident. But her medical history revealed a crucial underlying factor. She had also suffered sexual and intimate partner violence.
And she underwent reconstructive and cosmetic revisions to try and fix the area, hoping it would resolve her distress. But afterwards, she reported that she still defined herself as mutilated.
It didn't fix the underlying issue.
Not at all. Then you have the 44-year-old patient. She was a former heroin addict in a substitution program. She underwent a cosmetic labiaplasty, which was followed by a corrective surgery for wound failure.
And the psychiatric notes state she became obsessed with and disgusted by the surgical result. She completely stopped having sexual intercourse because of her negative genital self-image.
The psychological toll was so heavy.
She experienced a relapse of her drug addiction, followed by severe suicidal ideation that resulted in a psychiatric hospitalization. And she explicitly used the word mutilated to describe what the surgeons did to her.
If we connect this to the bigger picture, a vital connecting thread emerges. All three of the Geneva patients disclosed a history of sexual violence.
Okay, so if you follow that logic, the surgery isn't functioning as a cosmetic upgrade. It's functioning as a trigger.
Exactly.
Think of it like a computer system. You have a massive software bug, the psychological trauma of sexual violence. You can't fix a software bug by cutting out and replacing the physical hardware. The code is still broken.
That is an excellent way to conceptualize it. If a patient is carrying the invisible, crushing weight of sexual trauma, their relationship with their own anatomy is already incredibly complex. It is likely fraught with shame, dissociation, or a desperate desire for control. Seeking to literally cut away a part of that area might seem, on a subconscious level, like a way to excise the trauma itself, to cut away the part of the body that feels tainted.
But the scalpel doesn't reach the trauma. The brain processes the surgical removal of tissue not as a healing act, but as violent loss. It echoes the previous abuse.
Yes.
It's a repetition of an invasive boundary violation, even if they consented to it initially.
Treating deep-seated psychosexual trauma with cosmetic surgery is just a guaranteed recipe for severe psychological harm. The trauma isn't resolved. It is compounded by physical loss.
Knowing that past trauma and mental health issues can turn a routine cosmetic surgery into a psychological disaster, how on earth is the medical community supposed to handle patients asking for vaginal tightening or labiaplasty?
It requires extreme diligence because the statistics on cosmetic surgery patients in general are pretty sobering.
What do the numbers look like?
Research indicates that anywhere from 4% to 50% of patients seeking cosmetic procedures have underlying psychiatric conditions. Most notably, body dysmorphic disorder, or BDD, along with severe depression or anxiety.
50% is a coin toss. But let's dive into BDD for a second, because I think people misuse that term to just mean having low self-esteem.
Oh, all the time.
But body dysmorphic disorder is an actual neurobiological processing error, right? The brain is visually amplifying a minor or entirely non-existent flaw into a grotesque deformity.
Precisely. The patient looks in the mirror and literally sees something different than what the doctor sees. And body dysmorphia is particularly insidious because the patient is entirely convinced the problem is physical.
Right.
If a surgeon operates on a patient with BDD, the patient is almost never satisfied because the scalpel operates on the tissue, not on the brain's visual cortex.
They just find something else.
Exactly. They will instantly fixate on the new scar or millimeter of asymmetry, or their anxiety will just migrate to a completely different body part.
This is exactly why major medical bodies, like the American College of Obstetricians and Gynecologists, the Royal College in the UK, and the Society of Obstetricians and Gynecologists of Canada, They all strongly discourage these surgeries for purely cosmetic reasons.
They do.
The clinical evidence points to minimal psychological benefit and alarmingly high physical and mental risks.
But, medical ethics require us to draw a very careful, distinct line between cosmetic desires and true medical necessity. We cannot blanket state that all genital surgery is harmful.
Right. For instance, the clinical data surrounding gender-affirming vaginoplasty for transgender women paints a completely different psychological picture.
Very different. When you look at the UCSF clinical trials data and studies from the AUA journals, they demonstrate that for transgender women, vaginoplasty is a medically necessary intervention to treat gender dysphoria.
Right, it's not cosmetic.
In these specific cases, the surgery actively relieves profound psychological distress and social isolation. The longitudinal studies show it leads to greater overall happiness, significantly improved confidence, and a massive reduction in dysphoria preoccupation.
Because in that scenario, the surgery is actively aligning the physical body with the patient's internal neurological map.
Exactly.
It is resolving a profound disconnect rather than trying to chase a culturally manufactured cosmetic trend.
The treatment directly addresses the medical diagnosis.
So what does this all mean for cisgender women seeking cosmetic alterations? I can hear the pushback already, so what does this all mean? Are we saying women shouldn't have autonomy over their own bodies?
Right. It's a valid question.
Because it feels a bit patronizing to tell a woman she can't have a procedure just because a doctor thinks she might be insecure.
If we connect this to the bigger picture, patient autonomy is an absolute cornerstone of modern medicine. People have the right to make choices about their bodies.
Of course.
But medical ethics also demand non-maleficence, the Hippocratic Oath to do no harm. A doctor cannot ethically perform a procedure if they know it will likely injure the patient physically or psychologically.
Meaning, if a patient comes in complaining of a feeling of looseness, jumping straight to surgical tightening might be malpractice if you haven't figured out why they feel that way.
Exactly. The medical literature points out that a feeling of looseness or dissatisfaction can be related to pelvic floor weakness, menopause-related tissue changes, prolapse, or even low arousal and dryness stemming from relationship issues.
Right, so many factors.
If a patient is suffering from a weak pelvic floor, marital distress, or deep psychological trauma, burning tissue with a laser will not cure them. It is applying the wrong tool to the problem.
So the ethical burden is entirely on the physician to act as a gatekeeper.
Ethical practitioners must aggressively screen their patients. They have to take a full psychosexual history. They need to screen for coercion, like, is a partner pressuring them to look a certain way?
Which happens a lot.
It does. They need to screen for a history of sexual abuse. And they must screen for body dysmorphia.
Yeah.
The goal is to protect vulnerable patients from irreversible procedures that will only exacerbate their pain.
The Royal Australian College of General Practitioners recommends that doctors really dig into the why. Are they consuming vast amounts of airbrushed media?
Right.
Have they recently started removing all their pubic hair and are suddenly hyperfixating on anatomy they've literally never paid attention to before?
And often, education is the most powerful and effective medical intervention available. Showing a patient an anatomical atlas of normal vulval diversity, like the labia library, which was heavily referenced in the medical guidelines.
Yeah, that's a great resource.
It really is. It can completely cure their genital anxiety in a single afternoon without a single incision.
It's incredible what objective reality can do to dispel a digital myth. Just knowing that your body is completely normal and functional is half the battle.
Absolutely.
But if they do proceed, the informed consent has to be brutal. They need to know they are risking permanent nerve damage and chronic pain for an aesthetic change.
They must understand that a scalpel cannot cut away insecurity, and a laser cannot tighten a fractured relationship.
We have covered a massive amount of ground today. To synthesize what we've learned from this deep dive, cosmetic gynecology, vaginal tightening, and labiaplasty are heavily marketed as quick, easy fixes for self-esteem, youthful appearance, and sexual satisfaction.
But the clinical and psychiatric data present a starkly different reality.
A lack of basic anatomical education, intense societal pressure driven by algorithmic digital media, and underlying unresolved psychological trauma can turn these seemingly routine procedures into sources of profound harm.
It's true.
Instead of walking away with newfound confidence, patients can be left with irreversible chronic pain, dyspareunia, and devastating suicidal feelings of mutilation.
It underlines the absolute necessity of rigorous psychological screening and honest, evidence-based conversations before anyone gets near an operating room.
Which brings me to a final provocative thought for you to mull over. We've talked extensively about how these procedures are currently being driven by passing trends. The Barbie vulva, the Brazilian wax, the inescapable influence of modern digital filters.
Right.
But aesthetic trends are, by definition, temporary. Think about the pencil-thin, plucked eyebrows of the 1990s or the bone-crushing corsets of the Victorian era. Society is always inventing new ways to demand physical perfection.
And those demands always expire and get replaced by new ones.
Exactly. So if we are permanently and surgically altering highly sensitive, incredibly functional parts of the human body to fit a passing societal fad, like a clothing trend or a specific style of hair removal, what is the long-term psychological toll on a generation of people who will eventually outlive the trend?
That's a great point.
How will they feel about those permanent, painful alterations when the culture inevitably moves on, but their anatomy cannot?
That is a profound question, and a necessary one for anyone considering these procedures.
Thank you for joining us on this deep dive. Keep questioning the marketing, keep looking past the glossy brochures, and we'll see you next time.